Hi, today I wanted to talk to you about a question that I got the other day, and the question was, what is corrective care? So a lot of people are not aware, but in chiropractic, there can be some phases of care that you go through. Typically, a lot of people come to see their chiropractor when they are in pain. And so that's kind of, they wait till they have a problem, they wait till it's pretty bad, and then I'm sure you can relate to this. When you can barely move is when you finally call me, and I'm flattered. So a lot of times my first goal when I meet someone has to be to immediately, as quickly as possible, get them out of pain and functioning again. And so that kind of is the first phase of care, if you will. It's just, it's not about building up optimal wellness and function. It's not about being the best and healthiest you can be. It's about how do we get you to stand up and sit down without pain, to get sleep at night, and to be able to turn your head and bend over and pick things up without your body screaming at you. So that's going to not be corrective care. That's going to be just pain relief care, get them in, get them feeling better, and that's what your insurance is going to pay for too. And so, the good news is, and kind of the bad news, is that many of us do have some aches and pains that sneak up on us and that we need treated each year, and that's why insurance is there to cover that. So that's going to be more of active care. That's going to be pain relief centered. Now, as you all know, just because you're not having great pain doesn't necessarily mean your body is functioning optimally. And finally, this healthcare paradigm in our country is shifting a little bit away from pain and disease and, problem centered. Like, I only go to the doctor when I'm hurting, or when I have some kind of, infection, or I'm really already in that disease phase. We're shifting. We're getting more into healthy diets. We're getting more into exercise. We're getting more into nutrition and learning and build supplementation to build optimal health. And we're worrying more about prevention. And that's what corrective care is about. So corrective care is literally to correct things like your posture, to keep you from having spinal degeneration. Spinal degeneration is getting worse and worse, and we're seeing people, slowly go from standing up straight to bent over. And a lot of my patients say, I don't want to be that person who's hunched over, hobbling around in pain. So that's why I'm here. And I just want to hug them or high five them. Like, you get it. Good job. So corrective care is going to be after the pain relief. Just because you're in pain doesn't mean that you're completely better or that you're preventing injury from coming back. A lot of times when you have an injury, it involves your ligaments going under injury and stretching out. Your ligaments are there to provide your spine with stability. When that stability is gone or decreased, then you have more movement, and it's abnormal movement. Abnormal movement and excess friction leads to spinal degeneration every time. And then the one thing in your body that can help stabilize you is your muscles. So your body goes, I don't have much stability in my neck or my low back or my ankle or my hips or my wrist or whatever it is. I don't have much stability there anymore from these injuries. But your body needs stability. It craves stability. That's its safe place. So your body, your brain says, I know, muscles, get to work down there. And what do you get? I mean, we feel it, right? Spasm, pain, and therefore subluxation or restriction in your spine. So the muscles can pull the bones out, the bones can go out, and then the muscles can protect around that. All kinds of different things can happen. So the corrective care phase is where truly kind of the magic happens. That's when you are out of pain. You're actually feeling pretty darn good, but you want to stay that way and prevent it. This can look like, for some people it can look like every couple of weeks. I know I personally try to get adjusted as often as I can. If I had someone sitting here waiting to adjust me, I would absolutely get adjusted weekly. But if that isn't as easy for you, it can even look like quarterly. It can look like monthly. It can just be, a matter of, okay, I'm not in intense pain, but I do have this little ache that happens every now and then. And when I feel it, I know it's only a matter of time until I'm injured, and that's when you give me a call. It can be any of those things, but it truly is the answer for preventing the pain, healing more quickly, feeling greater, preventing degeneration, and living optimally and being your best, greatest, most optimally functioning self. So, you know, a lot of people even come to me and just say, I just want to work on my posture. I don't really have pain. I don't really have much going on, but I don't want to in the future. So that's why I'm here. And that's why we have a series of exercises. That's why we have, you know, we give adjustments, and we also do muscle work when we do adjustments, because everything plays a role. And if you're not treating everything at each visit, you're probably missing some things. So if you have any questions back here, please comment below and I'd be happy to answer. You can always send us a message if you're interested in care. We'd be happy to help you out. And if you are watching still, please just drop in, wave, say hi, and we love to know that you're here and that you're watching. Otherwise, have a great day.